The first test I'm going to demonstrate is the inversion talar tilt test. This test is used to assess the integrity of the lateral ankle ligaments, mainly the calcaneofibular ligament, but it can also stress the anterior talofibular ligament depending on the ankle position. These ligaments are commonly injured in inversion and ankle sprains. To perform this test, I have the patient seated with their lower leg relaxed. I stabilize the distal tibia and fibula with one hand to prevent any rotation or movement. With my other hand, I grasp the calcaneus and gently tilt the foot into inversion or inward. I'm comparing the amount of movement side to side, and I'm also watching the patient's face for any pain response. A positive test is when there's increased inversion laxity compared to the uninjured side, or if the patient reports lateral ankle pain. This usually indicates a sprain or tear of the calcaneofibular ligament. The second test is the eversion talar tilt test. This test is used to assess the deltoid ligament on the medial side of the ankle. The deltoid ligament is very strong, so it usually requires a lot of force to injure it. To perform this test, I stabilize the lower leg that's the same way as before, then I hold the calcaneus and gently move the foot into eversion or outward. I'm checking for differences between sides and for any reproduction of pain. A positive test is pain on the medial side of the ankle or increased eversion laxity compared to the other ankle. A positive result suggests a deltoid ligament sprain, which is much less common but often more serious and takes longer to heal. The test I'm demonstrating is the squeeze test for a syndesmotic ankle sprain, which is also known as a high ankle sprain. The test evaluates the tibiofibular syndesmosis, which is the connective tissue between the tibia and fibula near the ankle joint. Injuries here often occur with twisting or dorsiflexion injuries. To perform this test, I place my hands around the patient's lower leg and gently squeeze the tibia and fibula together, starting higher up and moving downward. The goal is to create pressure that travels down to the syndesmosis near the ankle. A positive test is when the patient feels pain down at the ankle, not at the spot where I'm squeezing, but below. If the pain is specifically at the distal tibiofibular joint, it indicates a syndesmotic sprain or a high ankle sprain. These sprains usually take longer to heal than typical inversion sprains. The fourth test I will demonstrate is the Thompson test, which assesses for potential Achilles tendon rupture. The Achilles tendon helps produce plantar flexion or pushing the foot downward. To perform this test, I have the patient lie down with their feet hanging off the end of the table. The fourth test I will demonstrate is the Thompson test, which assesses for potential Achilles tendon rupture. The Achilles tendon helps produce plantar flexion or pushing the foot downward. To perform this test, I have the patient lay down with their feet hanging off of the bed. I squeeze the calf